we have Dean Kereiakes on the line with us, who has been there from the beginning, the middle, to the current state of the art of interventional cardiology, renowned in the coronary space.
And I'll try to summarize it about what I don't know, 40 to 50 years of we call wearing lead. That's what you do. You wear lead. Initially, we put robes on that weighed about 30 pounds. Now, think about working 8 to 10 hours a day, or bending over patients, looking up at a screen with this thing hanging on your neck, and it's 30 pounds. And sometimes you would almost stay still for up to 2 hours. On tough cases, you weren't walking around, you were, standing there looking up at a screen. And the problem with, I think there's several layers, and I'll try to bang it out like bullet points. Number one, the equipment itself has evolved to get better pictures with less radiation. Now, there's a paper that's going to come out in Sky that shows that in at least the states of Illinois and California, that which is no different than the rest of the country, that a shocking up 80% of these hospitals in those states have at least one machine that is more than 15 years old. So it doesn't have the lower radiation, better pictures. And it's incredible. 50% of the hospitals have some machine that we call antiquated or senescent. And so the ability to work in labs where the machinery, you say, hasn't updated, that's a problem starting. So there's variability in exposure based on the type of machine that we get exposed to. Now, patients are in there. It might be 5, 10 minutes, 15 minutes for a quick diagnostic procedure. It might be an hour or two for some of these more complex procedures, and they get exposed to that as well. So this is not something that's benign for patient or doctor. Second is that everybody in the room gets what's called scatter. And scatter is radiation that bounces off the patient, bounces off the table. It comes depending on how you're holding the camera or viewing, and you can rotate these cameras around, and sometimes you get sprayed more with scatter, sometimes less. That it doesn't matter who you are. It could be, a nurse, it could be an X-ray tech or a doctor. You're getting scatter radiation, and the exposure to scatter radiation is cataracts and cancer, as you pointed out. It's clearly related. There's no question about it this time. In fact, I'm going to digress briefly. You can show abnormalities in DNA related to radiation in people after doing these cases, where you get a blood test and you can see that. And I can send you those articles. So we get
That's frightening.
You'll be absolutely shocked, because I think of all the radiation at times to save a patient that we literally straddled over the X-ray generator, pumping on a chest, or to get close enough to put some catheter in the neck or things like that. You're trying to save somebody, and you're literally getting sprayed directly, not even scatter anymore. We're talking about direct radiation. And there is evidence of cellular damage in the people like us who are doing the procedures, in addition to the patient who obviously is getting the procedure. So the lead has evolved. It became light lead, which is about anywhere from 14 to 16 pounds. And when I give lay people, I say, "Hey, or hold this jacket," and they go, "Ooh, you wear this all day?" And I said, "This is a gift. Put 2 of them on." Okay. And they get it. And so it took a long time to prove, but on July 15th, the pivotal white paper that combines at least 5 societies, think about like, herding cats. You've got echo, radiology, vascular surgery, American College of Cardiology, Society of Cardiac Angiography and Intervention, all came together. David Reisig is a lead author on this. I'm a co-author. And it's a mandate that things have to change. We actually now have fewer people going into interventional radiology, interventional cardiology, and particularly women who are concerned about the health risks of pregnancy, exposure to radiation, um, and wearing lead. It's become a deterrent because of occupational hazard. And it really is no longer. Give you an example. We got Chuck Abbott-Smith, Englishman from Montreal, used to be hyphenated, chief of the cath lab at Christ Hospital, who was really one of the classic, just a wonderful leader in cardiovascular medicine in Cincinnati when I joined him. Then about 4 years later, Chuck and I hired a young guy named Tom Broderick. And I'm going to get to the point here in a minute. Irish Catholic, just a wonderful guy. Everybody in his family is a doctor or a priest. And then you got me, who's second generation Greek American. We have nothing in common genetically. And yet, Chuck Abbott-Smith has had 4 separate spinal operations. I had an emergency discectomy in 91. And in February, I wasn't smart enough to react to the signs and symptoms I was getting, the change in my gait, how I walked. Other people noticed it, and I just took prednisone, which is what I would always do to ease the pain of wearing lead. I became transiently quadriplegic because cervical spine.
You were scheduled to go into work, and of course, having, possibly the only person having more of a Marine Corps mentality than I did. I used to jokingly tell the fellows anything involving family, uh, don't come to work. If you have any kind of important personal issue, don't come to work. But the indication that I used personally for illness to not coming to work was undergoing CPR. Unless, not that I had just recovered from. If I was actively undergoing CPR, I would not come to work. It was kind of an exaggeration, a little bit of a. I don't know if that's a metaphor. It's not, but we came to work. But you were ready to come to work, but you couldn't get up off the floor. That's the only reason you didn't go to work.
First, I got out of bed and my right foot was flopping. I couldn't. I said, darn, I got 3 aortic valves to put in, transcatheter aortic valve replacement today. I was really frustrated. I said, I said to my wife, it's like 5 a.m. in the morning. I said, I'm going to have one of those neurosurgeons see me. I'm thinking speed dial, Tobler Bohinski guys at my hospital. And I'm going to see them after we do the cases. Well, then I put my scrubs on and I get this incredible pain in the middle of my upper back. And then suddenly my arms are flopping. And I said, oh man, and then I had trouble standing up. So I slowly laid down, yelled for my wife to wake up, and I couldn't walk. So they came with a EMS. They took me to the hospital. They bombed me with steroids, Solumedrol, hydrocortisone, and I got better transiently. They did all the scans. And then by 3 a.m. the next morning, I started to posture, and you look like a praying mantis when you do this. Your elbows are flexed up, your wrists are flexed down,
You were
your
literally
arm, yeah,
on your way to becoming quadriplegic or dead.
yeah. And they rushed me
No
to operate.
exaggeration.
So the point of the story, though, and I don't want to digress,
Well, we only got
is,
about 30 seconds. So could
and
you?
I'll make it quick. I had a complete fusion posterior. They didn't come the way they like to. Anterior was an elective case. And they fused my cervical spine. Tom Broderick had the same procedure. Okay. And, well, the point is, we are like the 3 of us that used to clock over 1,000 procedures each a year, over 4,500 procedures a year at Christ Hospital, that we all are either 4 spinal operations, 2 spinal operations. 2 of us have had
Unbelievable.
surgeries.
Right before the break, we had reviewed the occupational hazards. You did it a little more systematically and talked about the paper uh, from jointly co-authored. It's apparently been in preparation, very thoughtful for more than a year, and you did mention that it's not going to be out. Well, it is going to be out very soon. Let's be positive. A week from today. Uh, but any little insights you could give us from that? Is it going to be powerful, definitive, wishy-washy? What can you tell us without compromising your ability to ever be an author of anything again?
Yeah, your first two words, powerful and definitive. In our profession, you and me, and all the other thousands that work in X-ray labs, interventional radiologists, et cetera, if you're in that profession for at least 15 to 20 years, you have a 60, not six, but 60% chance of having a cervical or lumbar spine injury significantly. This is, you heard Jim Hermiller from the podium as president of Sky a couple of years ago say that if we were Ford or GM, OSHA would shut you down. They'd put a stop to it. And this is the level, extreme level of occupational hazard. So in the paper, I'm very proud. And when you get 5 societies agree to put words like this is a mandate, it's a moral imperative to for workplace safety and the health and welfare of not only these quote hospital employees or the physicians, nurses, and technicians, but even patients who are there getting exposed. So it's very important. We have where I work now, my event, the silver lining of my event, where I still have, spasticity in my legs, and I won't go into it, but I still got permanent neurologic deficits, but I'm back in the lab doing a much lower volume of procedures, lead-free. We have 10, I think now 11 lead-free labs. That means we wear a monitor, which we never did before. 5 minutes into a case, the tech will say, hey, you got 0.01, minuscule, you're getting some exposure. So we adjust shields and equipment, and we have a technology called Egg Nest. I was in the hospital bed paralyzed when Santiago Garcia and Jared Frizzell, two of our top interventionists in Christ, evaluated 3 different systems, including Protigo, Rampart, and there's another fourth called Radiaction. They're all out there now. So they're available. I think they're moderately priced. I don't think it's outrageous. But hospitals have been reluctant to buy the equipment because it's incremental cost and you don't get any more reimbursement for it. So it cuts into their, if you will, margin. And that's a problem. There are philanthropic dollars that we have been able to use because grateful patients who want to help those that help them, so to speak, have donated, significant amounts of money to help move the bar. I think if the hospitals don't do this, that's the silver lining of Christ, is that it basically, the hospital chairman of the board said to me, a longtime lawyer, biggest law firm in Cincinnati, he said, our ROI, return on investment, is going to be workplace safety and liability. And those were the exact words. And what will come, and I hate to see that significant change that should be obvious occur because of litigation. But if there are hospitals out there who are saying, we're just not going to do this, we don't need to do this, they will be involved in a class action suits, et cetera. They're
But does
going to.
this joint statement, this article that's going to come out in a week, does it specifically specify that mandate that these systems need to be put into place ASAP? Again, I don't want you
Um,
to compromise anything.
um, I would say yes.
Okay.
And to me, that yes is not revealing what's said in the article, for which my beliefs and sentiments are very consistent with what's in the article, obviously. But it's yes because it's obvious. It's obvious. I don't know any profession that has that level of workplace hazard. Now, put it out to your audience. Would any of you in the audience do something where you knew you had a 60% chance of having a neck or back serious disc problem, or need an operation or get injections, epidurals? And those of you who are listening, and it was from your work and you couldn't claim, uh, workers' comp. This is not, now people are, and that's coming, workers' comp. I think and there's going to be, I think, a lot more litigation that'll steer the ship in the right direction. And to me, that's very disappointing, almost depressing. It shouldn't
Uh,
be litigation. It
no,
should
of
be us
course not.
doing the right thing, Fred, the right thing.
Of course not. All right, so Dean, I'm going to let you go. Final, I want you to give me 60 to 90 seconds on anything, life, your career, just 60 to 90 seconds on anything.
Wow. I think it wouldn't be so much life. I would say it'd be more life, not career. That in a world where you can be anything, at least be kind. I always say that to myself and use that as somewhat of a guiding light. Treat everyone with respect. I'm dead serious, right? I think these are just basic tenets that uh, make our world a better place.
Thank you, Dr. Kereiakes. More of your questions, one more movie, final segment after the break.